Hello, everyone. I'm Dr. Renee Mehrra, and today my guest is Dr. Shanta Oberoi. She has a bachelor's in Homeopathic Medical Sciences and Surgery and has over 25 years of experience in homeopathy. And Dr. Shanta Oberoi has been treating many clients with great health outcomes. So let's go to India and meet Dr. Shanta Oberoi. Welcome, Dr. Shanta Oberoi.
Hi, this is so nice to be here in the interview. It's really nice.
Now, we know that homeopathy was founded in 1796 by a German physician, Dr. Samuel Hahnemann. And this form of alternative medicine is based on the principles of similars, the law of similars. So tell us exactly how homeopathy works. I know it stimulates the body's response, strengthening the immune system so that one can fight the ailment or disease that is one going through. But tell us from your perspective as a doctor in homeopathy, how this form of alternative medicine works.
The law of similars is similia similibus curantur, as in layman's language, like cures like. So the medicine which we give is the one which creates same symptoms in healthy person and cures the same symptoms in sick person. So it's like scientific therapeutic system of medicine, which the medicine is so diluted, it just triggers the symptoms to get better in just very diluted form of medicine.
I see. Does it contain any steroids?
No, not at all. See, when you are getting results with natural things, why would you use steroids? With God's grace, we are getting very good results with homeopathy in lower potencies and higher potencies. Why would we use it? You know, basic purpose is to restore people health to healthy form. So why would we use steroids?
Can this be taken along with allopathic medicine?
Yes, of course, you can take it, but you won't need to because you'll get such a good results with homeopathy that you won't require allopathic medicine. Except for very rare cases, you won't require it.
In a medical condition, like somebody is wanting to go for surgery, could be tonsillitis or kidney stones, is homeopathy recommended for that person as well?
Yeah, definitely. See, some cases I would never recommend, getting surgery done because I know that that's gonna give you instant results, but that's gonna suppress the disease and it's gonna come out in some other form, especially in cons, warts, piles, then say ligament tear, then say some people they have abscess and boils, they go in for surgery. I would not recommend that. For sure, with homeopathy, we treat it. I know, like for warts, it takes little time, especially piles, warts. But cons, you get immediate results. Then tonsillitis, then sinusitis, then adenoids might take little longer. But for these problems, definitely kidney stones, immediate relief is there. It's not like it's gonna take you forever to get rid of them.
So how long does it take for homeopathic medicine to actually work to strengthen the body system?
See, it depends. One thing, it depends like how accurately patient is following the regime which you tell them. Second thing is different diseases. Say like for tonsillitis, say now we've gone through pandemic. Like it doesn't take forever to get cured for that. You get immediate results. Especially, I remember just now one of the patients, they took it for mouth ulcers. They were suffering for months and they took one dose at night and in the morning it was cured. It was really God's grace. But on the other hand, see, like if you have piles like warty growths, or it might take some time, like tumor kind of growths, it might take some time. But it's not like that it takes very long time to get cured. You start seeing the changes day by day.
Now, Dr. Oberoi, I know that there are over 3,000 remedies in the homeopathy pharmacopoeia. How does a homeopathic doctor, when the person is going to, looking for detailed analysis of symptoms of a patient, how do you choose what's the remedy is going to be effective for this symptom? So how are you choosing? There's so many symptoms that the person may have, and there's so many remedies for these symptoms. So how does a seasoned homeopathic doctor choose?
In homeopathy, our law is very different. And with God's grace, definitely experience really helps you in that. We individualize patient. It's not like, um, other system of medicine that you have patent, the same medicine is going to be effective for acid reflux. No, it's not going to work with us. It's we individualize the patient, keynote symptoms we take, then we take location. Like, let's say one person is having headache. The same medicine won't be effective for the other person
Right.
because the person whom I'm giving the medicine, it depends which location he's having, what kind of sensation he's having, like along with headaches, what kind of other concomitants, let's say vomiting, acidity, some like aggravations and ameliorations, like what aggravates and what gives him relief. All these symptoms that helps us to choose the right medicine. And definitely with God's grace, that's the biggest thing.
I see. Now, we know with the pandemic and these challenging times that all of us are going through, there's been a lot of mental health issues. And this being a mental health awareness month of May, do you have a lot of patients who come to you for depression and anxiety, bipolar?
Definitely. Because of COVID, you won't believe it, like people, because they are confined and they are away from their normal routines and no routine, nothing, no going to school, no going to office, just confined to four walls. Even young kids, I'm getting patients, especially for panic attacks, anxiety, loss of appetite, then lose motions. And like it can be in any form. You feel breathless, then depression, loss of sleep, lack of confidence, everything. Like lot of patients are coming and we get 100% solution with the homeopathy as well as along with that meditation really helps. It really helps.
Right. Meditation is always given as an adjunct therapy by even, medical doctors here. And so you prescribe, you recommend, you suggest meditation as well to your patients?
Definitely. See, I generally recommend them for high blood pressures, for obesity, for diabetes, for cardiovasculars, for mental health,
Every
as
illness.
well as, yeah, almost every illness. Because homeopathy is based on, like, if our vital force, we call it vital force, you call it soul. If that is deviated, then the body cries out in the form of signs and symptoms. That is what we call disease. But if vital force is not deranged, it's in the right place, and that comes to right place with either you give outside triggers with homeopathy medicine, or you give energy to soul or vital force through meditation. That's what it is.
Right.
That all the signs and symptoms you'll start feeling, they'll start getting better.
Have you seen greater health outcomes in your clients when when you suggest meditation to them along with your homeopathic medicines?
No, definitely. 100% results, especially say mental health, panic attacks. If you're getting panic attacks, if you're having high blood pressure, if you're having heart disease, if unfortunately, if you're going through some oncology problem, definitely you get the results.
Now, I know that homeopathic medicines stimulate the body's healing response. So
That's
you
correct.
first strengthen the immune system before you, or you also detox the person. and then you focus on their symptoms after that.
We see in homeopathy, whenever the patient comes to us, we don't tell them to go in for expensive tests and diagnosis kind of a stuff, but we take the problem which they come with, and we take the case in a whole extent, like their mentals, their physicals, and the whole case picture, and then we give the medicine, whichever similar medicine comes out, which individualizing with keynote symptoms, we just give
Would you recommend homeopathy to patients who are also going through terminal illnesses?
that. Yeah, unfortunately, during COVID times, many, like the cancer rate, I don't know, I feel it has increased. So we've been giving, especially for, say, in initial stages, for breast carcinoma, then lymph node enlargements, and different types of, especially for palliative treatment. It's really helpful.
I see. So along with allopathic drugs.
Yeah, actually, you can't. I tell them to be vegan and try, because see, plant-based diet, it reduces inflammation to a lot extent. So vegan diet and gluten-free diet, and along with a homeopathy, they can go in for, if they want, they can definitely go in for allopathic treatment too. But I think this plays a huge role in that.
I see. And it doesn't have any contraindications, any adverse effects.
No, that is for sure. Like it's not like you know other system of medicines. Like when they treat one thing and the other thing pops up. It's not gonna happen with this, and it's not gonna like contradict with the allopathic system of medicine or Ayurvedic medicine. If you're having, you can just continue, but you won't need it though.
A lot of people think those homeopathic medicines are like sugar pills. It has a placebo effect. What's your take on that?
No, it's not true. Once they take it, they'll come to know. It's not true. We see homeopathic medicines, those are vehicles. Like if you give it in sugar pills, or if you give it in less like powder like thing, or if you give it in dilution, alcohol dilution. It's like those are like vehicles.
Right, right, right. And what about children, infants as well? Can you give them homeopathic medicines, or there is an age bar here, like not under 3 years of age or 5 years of age?
No, I would recommend for babies, especially, it's much safer to give homeopathy than to give allopathy, especially say for teething, diaper rash, and baby milestones are delayed, or say to boost their immunity, cough and cold. Instead of giving like other system of medicine, I would recommend it's much more safer to give homeopathy. Any kind of allergies, say kids, infants, they have allergies, I would recommend giving homeopathy.
Is it safe to take homeopathic medicines for a long period of time? We're talking about like over a year or 2 years.
Definitely, it's safe. The For some problems, we have to at times give it for a year or so. Generally, we get results within 6 months, but at times we have to give it, say, for psoriasis or for prostate gland enlargement. We give it for more than a year. Lifelong, they have to take it, but it has no side effects for sure. And it's not that the dose will keep on increasing. Other school of system of medicine, the dose keeps on increasing. Like right now, you're taking 5 mg. After 2 years, it's going to be 10 mg, and that's never ending. But with homeopathy, nothing like that.
I see. And your website is drshantaoberoi.com.
That's correct.
Okay. And the email is also easy. It's obroyshanta@gmail.com.
That's correct, Renee.
So do you see clients overseas as well?
COVID, I know pandemic was really bad, like it has disturbed our lives, but it has taught so many things. Like during pandemic, I started everything online, and with God's grace, everything is going so successfully. My meds are going Malaysia, Philippines, Dubai, America, Canada, no barrier.
That's wonderful news. Well, thank you very much, Dr. Shanta Oberoi, who has a bachelor's in homeopathic medical science and surgery, and with over 25 years of experience in homeopathy. I'm Dr. Renee Mehrra. Thank you so much for watching. Stay healthy, stay positive. Thank you.